Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you with the COVID-19 update for Simcoe Muskoka. So, I last reported 2 weeks ago on January the 26th, and we now have 5,787 cases. So that is up by 593 from 2 weeks ago when I last reported. We've had a decline in cases over the last 3 weeks or so, which is certainly a good thing. For the week of January the 31st, beginning on the 31st, we had 279 cases. The week before that, we had 305 cases. The week before that, we had 444 cases. The week before that, 447. You go right back to the week of January the 3rd, where we had 495. So that is a month trend of downward cases. Tragically, we have had 38 deaths over the past 2 weeks. I would like to express my condolences to the family members for your loss. It's a very large number of people to have passed in that period of time. We've had a total, therefore, of 169 deaths. And 84% of those deaths was related to outbreaks. So I'd like to speak with regards to the cases that we've had so far this week, which is 54. A total of 36 of those were reported in the last 24 hours. 34 of those are sporadic cases, one from an institutional outbreak, one a community outbreak. 16 are men and 20 women. Their ages range from under 10 to in their 80s. 35 of them live in Simcoe County and one in Muskoka. 2 of them are acquired through community contact, and by that we mean we don't know how it was transmitted. 19 are close contacts of known cases, 1 part of an institutional outbreak, 1 in a community setting outbreak, and 13 under investigation. 34 of them are self-isolating, 1 recovering in a facility and 1 hospitalized. So at this point in time, we have 819 active cases, and this is down from 1,219 in total previous 2 weeks ago. And therefore, we have 4,760 recovered cases, which is up from 2 weeks ago at 3,826. We have 33 cases hospitalized, which is down from 35 2 weeks ago. Those hospitalized range in age from their 40s to their 90s. All are from Simcoe County, and 4 of them are in the intensive care unit. And they're located in a range of places, both hospitals, both within and outside of Simcoe, Muskoka. The weekly incidence of cases has gone down, in keeping with the number of cases per week having gone down. So the week of January 31st, our incidence was 47 cases per 100,000 population per week, down from 51.3 the week before. And if you go back to January the 3rd, when we had the beginning of this decline, we had 83 cases per 100,000 population per week. So presently, we're almost down to half of what we were over a month ago. The great majority of our cases are located in South Simcoe and in Barrie, so Bradford, West Gwillimbury, New Tecumseth, Innisfil, Essa, and the city of Barrie. The incidence of cases, therefore, has varied with that clustering of cases. And in the city of Barrie, we've had 64 cases per 100,000 population per week, which is a third lower than it had been the week before. I'm just going to turn down the speaker on my phone a bit. Here we go. And Bradford, West Gwillimbury, where we have the highest incidence of cases per 100,000 population, it is presently 102 cases per 100,000 population. And no other municipality in Simcoe, Muskoka has above 100. We presently have 25 outbreaks. This is up from 20 2 weeks ago. 8 are in long-term care facilities, 4 are in retirement homes, 3 are in hospitals. Actually, 2 of those 3 are in one hospital, RVH. 1 in a congregate setting, 8 workplace outbreaks, 1 community setting outbreak, and 2 educational settings. And educational settings can be schools or daycare centers. So if we look at the institutional outbreaks at 13, that's up from 11. And we have 4 new ones. AMICA Little Lake Retirement in Barrie, Mill Creek Care Center in Barrie, Georgian Manor Penetanguishene, Simcoe Manor in Beaton, RVH on their Cancer and Palliative Care Unit in the city of Barrie, Georgian Traditions in Collingwood. And we have 4 that are declared over: IOOF, Long-Term Care Facility in Barrie, the Pines Long-Term Care Facility in Bracebridge, Kingsmere Retirement Home in Alliston, and Muskoka Shores Long-Term Care Facility in Gravenhurst. We have 1 congregate setting outbreak, down from 3 2 weeks ago. That's at a group home in Simcoe County, so 3 that have been declared over, 2 group homes in Simcoe County, and a treatment facility in Simcoe County. We have 8 workplace outbreaks, up from 5 2 weeks ago. So 6 new ones, a agricultural facility in Simcoe County, a manufacturing facility in Simcoe County, finance an insurance facility in Simcoe County, a retail in Simcoe County, finance and insurance in Simcoe County, and food premise in Simcoe County. We have 7 that are declared over: transportation and warehouse, a professional science and technology services, a retail service, 2 manufacturers, an emergency services, and an agricultural facility, all located in Simcoe County. We have 1 community setting, which is unchanged, a real estate rental and lease location in Simcoe County, and 1 that's declared over, a development services location in Simcoe County. We have 2 educational settings, which is unchanged. Actually 2 new ones and 1 that's been discontinued. So a child care center in Barrie and Bear Creek Secondary School in Barrie are outbreaks, and we have 1 declared over at a child care center in Simcoe County. In terms of the COVID variants of concern, such as the UK variant, but the potential for other variants as well, we have the following numbers. And I think it's important to know that these are individual cases that have tested positive for these variants, and they are often, the great majority of them, part of outbreaks where we have other cases that simply haven't been tested yet, but in my mind are certain to also be UK variant outbreak cases, even though we don't have the test results for them. But here are the numbers for those that have been tested positive. So we have 133 cases of the B117 variant, the UK variant, and we have 64 cases that have screened positive for the N501Y mutation. So that's a mutation that's detected for screening purposes to identify if we may and are most likely dealing with a variant of concern. And once they've, at the Public Health Laboratory System, identified those, they go on and sequence them genetically to determine what variant they are. And so far to date, all of our variants that have been sequenced have been the UK variant. We've also had 46 negative test results on that mutation as well. There are 3 institutional outbreaks that have the UK variant: Bradford Valley, Waypoint Hospital, and Roberta Place. Roberta Place has had 65 test positive results for the UK variant, and another 18 having screened positive for the mutation that is consistent with them being a variant of concern, awaiting confirmation that they too would be the UK variant. Bradford Valley has had one secondary case of, or one case of the UK variant testing positive, and Waypoint has had one case testing positive for the UK variant. So in terms of vaccinations, we continue to vaccinate within our limited ability with a restricted supply of Pfizer vaccine. We haven't received to date any Moderna vaccine, so all of our immunizations have been with the Pfizer vaccine. And so we've administered over 22,000 doses to date, up 7,000 doses over the last 2 weeks. So 90% of those have been long-term care home residents, and 65%, I beg your pardon, 90% of the long-term care home residents and 65% of retirement home residents in Simcoe, Muskoka have received their first dose of the vaccine. And we are now continuing with providing second doses to those facilities. So we have 2,053 staff and essential caregivers who've received their second dose. Some 5,094 of them received their first dose to date. We've had 5,416 hospital workers and residents in alternate level care within hospitals that have received their first dose, and 2,417 have received their second dose. We have 2,880 residents of long-term care who've received their first dose, and 1,276 who've received their second dose. And in retirement homes, 2,375 of the residents have received their first dose, and we are proceeding this week with providing them with their second dose. In terms of our dashboard that we use, and this is different from the province's framework, we remain in yellow status. This is because we continue in yellow status for viral containment and spread. We still have a significantly high rate of transmission, even if it has come down a great deal. Our reproductive number is down to 1.0, which is consistent with us being in a steady state at this point in time, not necessarily going down. The figure for laboratory testing is at yellow because we've had continuation of our one-day turnaround time remaining below the goal of 60%, and our test positivity, though, has improved at 2.2%, down from 3.3% 2 weeks ago, which is a good thing. The health system capacity is yellow, which is unchanged. We have yellow status for acute bed occupancy, which is nearing the goal of 90%, so 81%, so some improvement there. Public health capacity remains in red, and that's just because we remain challenged in our ability to get to cases within a 24-hour period of notification. We're at 77.4%, which is below the goal of 90% or greater. Okay. Looking at our long-term care facility outbreaks, and I'll go through them in order of when they commenced, when they were declared. Trillium Manor Long-Term Care Facility declared on December the 14th. They have 23 positive staff cases, which is unchanged from 2 weeks ago, 2 essential caregivers, and 14 resident cases, up from 13, so up by 1, and they've had 4 deaths. The resident vaccination in that facility is 93%. Lakeside Retirement Residence in Innisfil, outbreak declared on December the 26th. Unchanged with 2 staff cases, and 92% of the residents are vaccinated. Grove Park in Barrie have 12 staff cases, up from 3 2 weeks ago, and one volunteer who's also a positive case. No resident cases, and that outbreak was declared on January the 4th, with 93% of the residents vaccinated. Roberta Place, and clearly this has been a tragic outbreak with a very, very high infection rate, all but one of the residents having been infected. We've had a total of 69 deaths at that facility. So 66 of those deaths have been among confirmed COVID cases, and 3 are individuals who, on history, are probable cases, but for which we don't have test results. We have a total of 100 staff who are positive, a total of 129 of the residents from 127. So 126 of those were confirmed, and 3 are probable, awaiting further testing. My understanding is that there's been some change in the total occupancy of that facility, with residents being readmitted from hospital, which has changed the denominator. And my understanding is that we still have one resident who's not become a case. We have 7 external partners who become cases, up from 3 when I reported 2 weeks ago. We have 2 essential caregivers, which is unchanged as cases, one of whom passed away. And that facility does remain in outbreak status. Contacts from that facility that are cases as well. So we have sorry, I'm just seeking to find that information. We have a total of 145 secondary cases, household contacts of the staff who've become cases, and we continue to follow that very closely with regards to the potential for transmission to others. And we have a total of 443 contacts that we're monitoring to ensure that they don't become cases, or that if they do, they've been kept in isolation and wouldn't be transmitting to other people. Okay. Royal Victoria Hospital, as I mentioned, they have actually 2 outbreaks on the go. So at the moment, I'll be referring to the one that is in their stroke unit, ISU, which began on January the 30th. A little bit later, I'll be referring to a second one that began. So at this point in time, they have a total of 24 patient cases, which is up from 19 when I reported last. They have a total of 9 people who've passed away, which is up from 5 when I reported last, and 26 staff, up from 23 when I reported last 2 weeks ago. Bradford Valley Care Community is one of the outbreaks that is from the UK variant. And so we have a total of 6 positive staff cases, up from 4 when I reported 2 weeks ago, and 15 resident cases, up from 8 when I reported 2 weeks ago. We've had 2 deaths to date. And in terms of their UK variant status. We've had 3 of the staff who've come back positive for the UK variant, and a total of 6 residents who've been tested positive for the UK variant, and 4 who've been screened positive, likely to have a variant of concern, having the N501Y mutation. So further testing results pending, but I feel quite confident that in fact all of the cases are due to the UK variant in this situation. Waypoint Center for Mental Health in Penetanguishene, outbreak declared on January the 22nd. We have a total of 12 staff cases, up from 1 when I reported 2 weeks ago, and 16 patient cases, up from 1 when I reported 2 weeks ago, and a total of 5 deaths that have occurred among residents. So this is a very concerning outbreak as well, and clearly has very, very much expanded in the past 2 weeks. And this is one of the UK variant outbreaks as well. So we have 1 staff member who's tested positive for the UK variant, 4 who've screened positive for a variant of concern, having the N501Y mutation. We have 6 residents who are screened positive for a variant of concern, the N501Y mutation. And although the results will make it clear, in my mind, we are almost certain to be dealing with all of these cases being the UK variant. Amica Little Lake Retirement Facility in Barrie had an outbreak declared on January the 30th. To date, we've had 2 positive staff cases with no resident cases. Testing having taken place, and 88% of the residents are vaccinated. Mill Creek Care Center in Barrie, their outbreak declared on January the 31st, with 1 staff case, no resident cases, 97% of the residents vaccinated. Georgian Manor in Penetanguishene, outbreak declared February the 1st. 2 staff cases, 94% of the residents have been vaccinated. Simcoe Manor in Beaton, outbreak declared on February the 5th. 1 staff case, no resident cases, testing taking place, and 78% of the residents have been vaccinated. Royal Victoria Regional Health Centre, their second outbreak is on their cancer and palliative care unit. It was declared on February the 5th with 2 resident cases, and test results being conducted on that particular unit. Georgian Traditions Retirement Home in Collingwood, outbreak declared on February the 7th with 1 staff case and no resident cases. In terms of educational facility outbreaks, we have a child care center in Barrie declared as an outbreak on January the 27th with 9 cases. And for these facilities, we don't actually make a distinction. The educational facilities, we don't make a distinction in our numbers between students and teachers, or for daycare, the clients and the attendants, just because the numbers are small and we want to protect privacy. Bear Creek Secondary School, outbreak declared on February the 1st with 3 positive cases. Congregate settings, we have a group home in Simcoe County, outbreak declared on February the 4th with one staff case, and test results are otherwise negative for everybody at that facility. Community settings, we have 1 outbreak in a real estate rental and lease location in Simcoe County, declared on February the 5th with 24 cases. And it's important to note that one of these cases is positive for a VOC of concern, the N501Y mutation. So certainly we are investigating that for the potential for this to also be a variant of concern UK variant outbreak. We need further testing results to be able to determine that. Workplaces, we have 8 workplaces in outbreak. One is a food processing facility in Simcoe County, declared January the 11th, with 19 staff being positive, up from 16 2 weeks ago. We have an agricultural facility in Simcoe County, declared as an outbreak in January the 29th, with 1 staff case. We have a manufacturing facility in Simcoe County is declared as an outbreak on January the 29th, with a total of 6 staff as cases. We have a finance and insurance facility in Simcoe County declared as an outbreak on February the 1st, with 6 staff being positive, and one of these had a screening positive for a variant of concern, the 501Y mutation, so further confirmatory tests required to determine if this is the UK variant. We have a retail facility in Simcoe County on February the 2nd with 3 staff members. We have a finance and insurance facility in Simcoe County declared on February the 2nd with 3 staff. We have a food premise in Simcoe County declared on February the 6th with 3 staff, and we have an agricultural facility in Simcoe County declared as an outbreak February the 2nd with 3 staff as cases. So going to my media notes, we have just finished with a media blitz in partnership with multiple ministries and with municipalities, just going to pull up my overall numbers that I've got here. We had a large number of enforcers participate in that event. So it took place February the 5th to the 8th. The Ministry of Labor, Trade, and Skill Development provided 33 enforcers, bylaw officers 13, the health unit 11 enforcers, public health inspectors, and police department 6. So over that period of time, for the health unit, I can't really comment because I don't have the data yet about all the other enforcement personnel and their activities, but for the health unit, we did 170 inspections and we issued 14 tickets. The most, and by tickets I mean violation charges. And so the most common infractions were a lack of a safety plan, a lack of screening of their employees, a lack of signage indicating capacity limits, and failings with regards to cleaning and disinfection. So clearly that was an important activity for us. Its timing was very good in that it helped us to deal with the emergence and spread, containment of the UK variant outbreaks that we've had. We do have our schools receiving students again this week. This is something that I've been calling for, and certainly it's important for children's mental and physical health and for their education. So I think it's a very good thing that they are back in school. It's certainly something that I heard a great deal from people about, particularly in northern portion of Simcoe County and Muskoka. So I'm very happy that we've been able to achieve that. But it is something we're going to have to manage very carefully with regards to COVID-19 and the UK variant. UK variant is more communicable, and we do want to be able to keep our schools open. It's important that we therefore all take caution in screening children, or those who work in schools, screening yourselves before going to school and not attending school if you're ill. Household members that are ill, be an important reason to withhold your children. Get those household members checked out to determine whether or not they're testing positive. Using face covering and mask as required, and that's expanded now to be more protective. So all of our school boards are requiring masks for the most part from junior kindergarten all the way through. This is a more precautionary approach than we had taken in wave one. One of our school boards had taken that approach, Trillium Lakelands, and had good success with it. And so as an added precaution, our school boards have taken that approach. I have heard some concerns raised by some parents with children in kindergarten requesting or positioning that this wouldn't be good for their children. I certainly would sympathize with this as something new and potentially difficult for you to be doing, but it is important that we do all that we can to protect children in the school environment and to allow them to continue to go to school. Public Health Ontario did a point prevalence study about variants of concern and the UK variant, and we received some results from that, and in the past I've been asked about more detail about the results. So what we learned was on the day in which they had done this study in late January, we had received 89 positive test results for a variant of concern. And I was asked what was the denominator in that. It was out of how many COVID tests overall from Simcoe, Muskoka were positive. And so the denominator is actually 140. So 89 positive variants of concern out of 140 tests that were positive for COVID-19 in Simcoe, Muskoka on that day. Or if you want a percentage, it's 63.6%. Were positive for a variant of concern. And 87 out of those 89 were tied with the known outbreaks that we've been managing. We're keeping we've expanded our health stats page to include detailed information about the UK variant and the variants of concern screening tests results as well. The province has a number of municipalities, I would say, have worked in partnership with universities such as University of Ottawa to do screening of their wastewater in order to detect levels of COVID-19. And now it is possible to detect the UK variant by this means. It's an approach to syndromic surveillance, and yet another tool for us to determine how much activity is happening in the community. So at this point in time, we're entering into a partnership with City of Barrie, University of Ottawa, and the Children's Hospital of Eastern Ontario in Ottawa to do this kind of monitoring for the City of Barrie. We don't have a firm agreement at this point as to how often we'd be getting those test results. I would like them frequent because that would help us monitor and know by another means just how much activity is happening here, how much transmission is happening here, whether it's going up or down, and how much of that is the UK variant. And I would like that to be in some of our other communities as well. So I know that Aurelia and Collingwood are in negotiations right now about the potential for this as well. There's been a lot of questions now with the province moving back into its framework with the color coding for different health units with varying degrees of restriction depending on the degree of activity of COVID-19. And the questions that have come my way have been, where will we sit when next Tuesday we go into that framework, as was announced yesterday by the province. And at this point, I don't know. So if I look at our data on this, I would make the case we would be better served to be in red as more protective, given that we have the variants of concern. But in fact, the trend that we have had overall has been downward, and our indicators are a mix between red and orange. So we shall see what decision the province makes on this. There's a substantial difference between orange and red with regards to gathering sizes and the number of people that can be in restaurants. Certainly that would be better for business, but it would be a higher risk for transmission in our community. So I think this is something that I would want to be in communication with the province about, and we'd want to look at this from the point of view of disease transmission and control, protecting our population. And I'm going to continue with the messaging that regardless of where we end up, it is very wise of us all if we continue to abide by a stay-at-home approach with this. It'll cease to be an order, but it would remain as an approach that is important for reducing transmission in the community. We know that there's been a good correlation between reduced movement in the community, basically people staying at home, not having people over, that is correlated well with reducing disease transmission and protecting our community. And this is important now more than ever with the UK variant in our community. So some questions that we've got for the media are as follows. How close are we to the Roberta Place outbreak being declared over? So certainly, although I've spoken to large numbers of cases and certainly tragically large numbers of deaths, with well over half of the staff affected, almost all of the residents affected, and large numbers of household members affected among the staff, transmission into their homes. In fact, the continued transmission has gone down quite dramatically. So we're getting very few new cases happening associated directly with that outbreak, and also out in the community in the homes, which is certainly a very good thing. It speaks to the follow-up that we've had to do as a health unit for case and contact management and having people go into quarantine. It speaks to people in the community abiding by the stay-at-home order, how important that has been for reducing transmission. So that's good news, and with that we may certainly be within anywhere from a less than 2 week period onward, depending on if we continue to get transmission at the site. If we continue to get some staff cases, then it's going to continue on. If that ceases, then it could end fairly soon as an outbreak. That doesn't mean that it's still not an issue in the community. We still have the potential for transmission to be happening in the community and to affect other households, other workplaces, even other communities. We've seen elsewhere in Simcoe County now a couple of workplaces in community settings which have a variant of concern, and we need to watch that very closely and see if it turns out to be the UK variant, and if in fact there's some kind of a linkage back to what we've been experiencing with their other three outbreaks, other three facilities that have the UK variant. We need to be very cautious, basically. And also with that facility, we need to be assured that they're in really good operating order, that there's nothing short, but they have to be excellent with regards to infection prevention and control measures and the ability to staff appropriately. So all of that needs to be managed as well, needs to be continued to be looked at very closely. And we've had very good response to that outbreak, both from the operators and also from community partners and the leadership that Soldiers Memorial Hospital has provided in accordance with my Section 29.2 order that I issued. So When the region enters the reopening plan next week, what color will we be at and why? And I've already spoken to that. Doug Ford talked about being able to put on a break if numbers of cases increase. How will this break work if the situation with the variants worsens, and when would you use it? So those are words from the Premier, from the province. So to me, I do not have a clear understanding as to exactly how that would play out. I think we need to be very cautious. I think that there's definitely a risk being taken by the province in moving into the framework at this time, as opposed to continuing with the stay-at-home order and the shutdown. We still have high numbers in this province. We have a variants of concern circulating in the province. We have Simcoe, Muskoka with outbreaks of variants of concern happening. We need to be very cautious. The province is moving in the direction of making this change. I think they need to be ready to move right back again into shutdown and stay-at-home order if numbers start to go up. And if they do start to go up, we know that it'll take some time before they come back down again. So you can see it go up, and that means it's been already going up in terms of transmission for the preceding 2 weeks before you detect it. And there's an inertia to this, which means it'll take a while after you put those measures in place before it peaks and comes back down again. That's inherently part of the risk of the approach that they're taking. Are we expecting a steady flow of vaccine coming in the next weeks after long-term care retirement homes, hospital and First Nation communities? Who is the next priority? So I am looking forward to getting a steady and increased supply of vaccine. At this point, we are only getting very limited supply at a time to be able to give our second doses. I would like to do a shout out to South Lake Regional Health Center, who are providing us with some doses to tide us over for a one-day period until we get the supply that we're expecting tomorrow, and we will be giving that back to them. So that kind of neighborliness has been critical. That's the stage we're at right now, just getting enough to be able to give second doses. We hear media reports that the province would be, and the government, the federal government would be in a position of receiving much more in March. I certainly hope that's the case, and we are getting ready to be well positioned to be able to immunize when that happens. We have 6 regions that we're working with and community partners in those regions, primary care and community pharmacies and hospitals, in order to, in municipalities, about facilities that we can use in order to set up immunization clinics, mass immunization clinics, to operate with those partners, to be able to give it en masse throughout our district. We look forward to being able to strike that up and have that going with the arrival of more vaccine. And indeed, we will work through priority groups in keeping with the province's direction about that. So once you finish with the groups that I just listed there, and indeed we would need to go on and include our First Nations communities. We haven't, apart from doing a long-term care facility and an elder home, we haven't been able to do those facilities. So we'd work with those facilities, and they would be among the next to receive the vaccine. There's also healthcare providers in the community. There's paramedics. There's other first responders. Those would be key to be the next step. And then very soon we would be looking for those who are most senior, most elderly in our community, because age is the greatest risk factor of all. So I look forward to being able to be getting on with providing that service to those individuals. When it is time for seniors to get vaccination, or any other public group not associated with healthcare, how will they find out? Will they be contacted, or will they have to call the health unit or a hospital to book their vaccination appointment? So I would say that we're developing contact lists for healthcare providers, and we feel confident we'll be able to reach them. We're going to have to work very closely with primary care providers when it comes to immunizing say, those above the age of 80, for example. They are rostered with their healthcare provider. Healthcare providers, primary care providers, will be able to help us in identifying them and reaching out to them in order to help book them for immunization. Eventually, when we get a very large supply of vaccine and get to the point where we're getting vaccines that are easier to handle, with the eventual approval of AstraZeneca as a vaccine, we would like to be able to work with family physicians and pharmacies, and I would hope that they would be enabled to be able to provide vaccine at their premises as well, not just at the clinics that I've cited. So that, I think, would be, through family physicians' offices, for example, would be a way that would be more convenient, potentially safer for senior citizens, elderly people to get immunized. So this is a work in progress. We still need to continue our local planning, which we're doing expeditiously right now, and no doubt even with a fine degree of planning, we'll have to adapt planning depending on what happens, what type of vaccine comes and when. But I feel confident that in the weeks and months to come, we will succeed in moving through the entirety of the population into the summer to be able to make it available to everybody who wants the vaccine, everybody who would be eligible, those 16 years of age and above who don't have a contraindication. So at this point, I'd be happy to take questions.
Okay, thank you, Dr. Gardner. We're going to start with Erica Engel from Collingwood today. Thank you. Hi, Dr. Gardner.
Hello.
I wanted to ask, there were a little over a dozen cases in Collingwood that are listed as outbreak related, posted to the health desk site yesterday. Are you able to tell me how many of those are associated with a single outbreak, or maybe how many outbreaks are involved there?
So what I can say, just looking from the notes that relate to this, I did cite one location in my outbreak narrative that, although I didn't actually give the name, so I still won't be giving the name. But anyway, I did cite one, and what I would say is that we do have an outbreak in Simcoe County, and I won't be specifying which municipality, that involves a cluster of individuals associated with the multi-unit premises where they live, and we are working with that entire building and with everybody involved in order to ensure that they have access to testing, that they are informed of the situation, that they are put into isolation when needed or quarantine. So we are managing it as a single outbreak. Okay, and is there any screens positive for VOC? We have one individual who has screened positive for a VOC with the N501Y mutation, and we're awaiting further testing. Okay, thank you. And the inspection blitz that just happened in partnership with the Ministry of Labor, are you posting all of the fines on your website, or just the fines issued by your inspectors? Just those that are ours as a health unit. Thank you. You're welcome.
Thank you, Erica. We're going to go to Laura Stone from the Globe and Mail.
Hi, Doctor. I wanted to ask you about the stay-at-home order. They were trying to the framework you mentioned in your comments there. So it sounds like that you would have preferred Ontario to keep the stay-at-home orders for now. Can you expand on whether, what you make of the fact that we're returning to the framework, if you have, as you've seen in your health unit, how the variant can travel? What are your concerns, and what would you have preferred that the province do?
My concern is that we're losing an important control measure, something that is very helpful, I believe effective in reducing transmission. It was something that we were focusing our messaging on at this time with the UK variant. I had simplified my message to the public to be obey the stay-at-home order, stay at home, only go out for the essential purposes, do not have people over, do not go over to other people's homes. By that means reduce the risk of transmission in the community now that we have multiple locations now with the UK variant in Simcoe, Muskoka. I would prefer that we had been able to keep that control measure, and I think the risk that we're now taking is that we may have more transmission. You might have a greater degree of transmission of this much more transmissible virus that has proved to be quite dangerous in the outbreaks that we've had, in particular Roberta Place, but we're also really seeing it very much at Waypoint now as well.
Okay, thank you. Sorry, go ahead. Yeah. Thank you. Sorry, just to follow up, Doctor, would you have preferred Ontario stay under the stay-at-home order? And just on a clarity point about Waypoint and Bradford Valley outbreaks involving B117, they seem to have a slower. They seem to have spread slower than at Roberta Place. Is that correct? And can you speculate on why?
Okay, I'll take the latter question, then I'll ask you to restate the former. So they are slower. I don't have a clear understanding as to why. Certainly, I would say that Waypoint has progressed quite substantially over a 2-week period when you had only 2 cases. You have many more than that now with 2 deaths. So it's not nearly as dramatic and explosive and tragic as what we saw at Roberta Place, but it's still worrying enough. But no, I don't have a clear understanding as to the differences, why it's played out differently. Could you restate your first question?
It was just for clarity's sake. Would you have preferred, or do you want Ontario to remain under stay-at-home order as opposed to returning to the framework?
I would have preferred it. I think that we still have. It's already been noted provincially that we're in a precarious situation. I'd rather that we'd waited until it was less precarious, that you had lower numbers, and for that matter, you've got the emergence of these variants of concern. I'd rather we waited to see what happens with that. You're starting with schools again. It would be better to avoid the potential for resurgence in the community that could endanger the ability to continue with schools being open. So I would have preferred that it had been kept in place longer.
Thank you. We're going to go on to Dawn Huddlestone from the Huntsville Doppler, please.
Thanks, Leslie. Dr. Gardner, are you aware of what the delay in testing time for variants is currently, and how that might impact local transmission, and in particular people's sense of urgency for following orders?
My understanding is that it takes 1 extra day after they've got their positive COVID-19 test result to get the screening test done for a variant of concern, and following that another 3 days to do the genetic sequencing to determine if it is the UK variant. And obviously it's always better to have quicker results all the way along. It's better to have quicker results with your original test for COVID-19, and I think it helps in our ability to get to people quickly and put them into isolation. It helps in being able to get in place control measures for outbreaks in facilities, and I do believe it would help us to know more quickly if we were dealing with a variant of concern. because it's certainly getting people's attention, and people take it very seriously, and I think that helps us as well.
Thank you. And we're seeing advice out now about double masking. What would your advice be for local residents on that?
I would still be sticking with the advice from the province, from Public Health Ontario, from the Public Health Agency of Canada. They have some very detailed advice about design of masks, and basically looking at a tightly fitting mask covering the nose and mouth properly, the chin, that is 3-layered, that is kept in good working condition, is changed if it gets wet, that people have to handle it properly so they don't contaminate themselves, and use hand sanitizer. I would rather that people stuck with that. If they're going with a second mask, they need to be careful about the design, that the masks they're using are good masks. They need to handle them properly so they don't contaminate themselves. I need to be aware of the fact that you still have to be able to breathe well through the mask. If you have too many layers, potentially it could make it more difficult to breathe well through all those layers. They're potentially more wasteful as well, depending on what you're doing, if you're talking about reusable or disposable masks. I think in the end it's important for people to use masks and use them properly, and I guess I would rather they were using 2 masks than being non-compliant, not wearing any, or wearing a mask that's inadequate, such as a valved mask.
Thank you.
You're welcome.
All right, we're going to go on to Holly Mackenzie-Suter from Canadian Press. Hi, thanks for taking my question. I had a question about something you said last briefing about the Roberta Place outbreak and how kind of the size and scale of that impacted case management efforts. So I was just hoping you could go into a bit more detail about specifics and how that outbreak kind of complicated public health work, especially as you're tracing the variants in the region.
So it required us to give a lot more focus on case and contact management, specifically to that outbreak and then the other VOC outbreaks that have happened, variants of concern, and to take a lot more detailed information. We, for a long time, had scaled back the amount of information that we were taking from cases, and we were having them follow up with their own contacts. And with this situation, we didn't want to do that. We wanted to be a lot more hands-on managing of the situation. And we didn't have the resources to do it, so we turned to other health units. 3 other health units provided personnel to assist us, and they were able to do that because we all work remotely now. And also the Ministry of Health has a body of individuals that can assist as well in this. So through that means, we were able to get a lot more assistance to be able to do the job much more thoroughly. And we're continuing to do it in that way because the situation is not over by any means. I've already cited that we potentially have this other cluster, that we're investigating associated with the housing unit. I just really want to commend the health units that have helped us with this, which has been Hastings, Prince Edward, Kingston, and Renfrew. Their assistance has been invaluable to us.
Thanks, and just a quick follow-up on that too. I've seen on the kind of COVID page that deaths were 4 times higher in January and continue to be high this month. So I kind of wanted to get a comment from you about how your region has become sort of the ground zero for the UK variant in Canada, and how that's kind of changed the story of the pandemic in Simcoe, Muskoka. Any lessons learned from that, I guess, as the rest of the country seems to be kind of catching up there?
Well, it's been a tragic loss of life. And one of the things we've really had to focus on is providing mental health supports for the responders to the situation. It's been very hard for everybody involved. In the first wave, we had a total of 36 deaths. And in Roberta Place alone, we've had 66 confirmed COVID-19 deaths, 3 probable, so almost twice as many deaths from that one outbreak alone compared with all the deaths that we had in the first wave. So clearly, the UK variant has had an enormous negative impact here. The sheer number of cases that we've had is very worrisome. That whether or not we'll actually prevent it from spreading widely in the community is open to question. I've positioned before that we will do all that we can to achieve it, but it's probable that we won't, and eventually it will spread in our community. And some projections have indicated that in March it may become the predominant strain in Ontario by that point in time. Considering how rapidly it can spread, that's very concerning the experience that we've had with Roberta Place. That would be very concerning.
Okay, thank you. We're going to go on to Don McNeil from MyFM.
Thank you, Dr. Gardner, and
You're welcome.
Staff clarification that you mentioned earlier. You said that there were 4 people in ICU in Simcoe, Muskoka. Can you break it down for us? Do you know how many are in South Simcoe or are residents of South Simcoe?
I don't actually have that information in front of me.
Okay. Everything else is done. Thank you very much.
Okay.
All right, Craig Momney from CTV Barrie.
Hi, Dr. Gardner. I know you answered the framework question, but is it possible to divide Simcoe, Muskoka into different areas, allowing for more openings or a different color level to Muskoka or other areas that are lower in numbers?
So far the province has not gone in that direction, and on the whole I think that's wise. We've already seen with the colored approach, the framework in the province in the fall, that there was a continued increase in transmission with that approach, and I'm concerned that by moving back into the framework, we may see that again. And I think what drives that to a large degree is the ability of people to travel between the different locales. People that are in more restricted areas to go out of their area to less restricted areas to access services, and thereby inadvertently transmit disease to those areas. So if we were to subdivide Simcoe, Muskoka, I know that North Simcoe and Muskoka, they've remained with much lower rates of disease. If we subdivided the area, if the province were to allow that, that could very well be undermined, and you could very well have transmission happening as people from southern Simcoe seek services in northern Simcoe and Muskoka. I've often heard from businesses and politicians that they would like otherwise, and I can understand why. These restrictions are very hard on business and hard on people's income and ability to make a living. But I also understand why the provinces continue to take the approach it has about keeping health units whole in their approach.
Okay, thank you.
You're welcome.
Thank you. Ian McLennan from Barrie 360.
Hello, Dr. Gardner. Excuse me, I'm just wondering, you as a health unit break down, outbreaks of COVID at workplaces, if it's agricultural or what have you. Toronto Public Health is going to start releasing or has the location of workplace outbreaks on a weekly basis if it's considered rampant or sustained transmission, and I'm quoting here, or the workplace is large enough that the risk of privacy concerns are mitigated. I'm just wondering, because you did touch upon the variant in certain workplaces, is that something the health unit here locally might be exploring?
So far, we're not, and in speaking with my colleagues elsewhere in the province, they aren't. Actually, when we looked at Toronto's criteria, there'd be very few work environments that would meet their criteria in the first place for us. Most of them would be considered too small, that you'd be not releasing their name on that basis. My understanding actually from the media is that Toronto's moving to be even more liberal about giving out names of all locations, but other health units and date have not. We're always considering the need for the public to know something to protect themselves, so we give lots of information about what's happening locally, and we give actually a lot of information about outbreaks and categories of facilities and premises and outbreaks and the stats. But we've held off in giving the names because we need to protect privacy of individuals and also to seek to do no harm to premises if we don't have to, if it's not necessary.
And Doctor, also too, with ski resorts being allowed to open on Tuesday of next week, there was concern back in the summer, people talking, but people from the GTA coming up to their cottages. The ski resorts obviously are desperate for, business, and that means dollars. Is there any messaging you would have for people who want to head north to hit the slopes, or, what would be the message, considering it's an outdoor activity?
Yeah, and outdoor activities are safer, but I would still be recommending people abide by the general message of stay home and not travel between districts, because although an individual might not prove to be a problem, when you have many thousands of people doing it, that means the movement of disease and transmission elsewhere.
Thank you.
You're welcome.
Okay, we're going to move on to Karen Howlett from the Globe and Mail. Are you with us, Karen?
Hi, I'm one of Karen's colleagues, Kelly Grant. Karen had to run to FOA.
Okay.
Okay.
Go ahead, Kelly.
Okay, if I can get a question in, I just want to understand a bit more about the variant situation there, if I can. The total number of the UK variants that have been confirmed or are under, I guess, under investigation of the thing, because they sort of triggered this screen. If I'm understanding the numbers correctly, and there was a lot at the beginning of this news conference, it seems like there are quite a few more cases, even just associated with Roberta Place, that are likely connected to the UK variant. So how much further do you think the UK variant has spread beyond either the confirmed or the preliminary screen positive numbers we have? Is it twice as much? Is it 3 times as much? How much further do you think it's spread?
One thing I've said is I believe that probably all of the COVID cases that are part of the 3 outbreaks that we have, Roberta Place, Bradford Valley, and Waypoint, probably all of them are the UK variant. And so we've got a subset of those individuals who've been tested. The results have come back from Public Health Ontario indicating that they have a variant of concern, and then those then go on to be sequenced and to be determined to part of those outbreaks. And so what I'm concerned about more is the cases associated with Roberta Place that are household contacts of the staff, and whether that group is growing or not. And when I look at the data, actually there's not a lot of growth in that right now. It's tremendously slowed down in terms of new cases. But I'm also concerned about this other cluster associated with the housing unit complex elsewhere in Simcoe County, and that's been identified with one individual having a positive screen for variant of concern. I'm concerned about what that would be and looking for the further test results to see if, in fact, more of those cases turn out to be variant of concern, and therefore I would be much more confident that they all are, and that I'd be looking for confirmation that they'd be the UK variant. So that would be concern to me, because that would suggest indeed we've got spread, and we've got spread to another community.
Follow up, Kelly?
Oh, okay. No, I think I'm good. Thanks.
Okay.
Thank you. Alice Allison Brownlee from MuskokaRegion.com, please.
Yes, thank you. I apologize, Dr. Gardner, I may have missed it. The 14 tickets issued by health unit inspectors to businesses based on infraction, do we know how many of those were in Muskoka?
Offhand, I do not. I know that of the inspections, 83.5% were done in Simcoe County and 16.5% were done in Muskoka. But for the tickets, I do not know offhand.
Thank you. We do know of one business in Bracebridge that received an infraction ticket.
Mm-hmm.
They disappointed, obviously, because they felt they had been following procedures and protocols. They were trying to keep up to speed. They hadn't complied with every inspection that had taken place from every level of government or agency, and still ended up with a ticket, obviously a financial burden on them. Is it fair to target businesses with inspections in such a difficult financial time if they are legitimately trying to keep up to date with all of the protocols?
So I don't have detailed information on any one particular location. I wouldn't be able to talk about that, but I would say that overall my staff are striving to apply the requirements of the law. The law is there to protect the workers, the owners, the patrons, and the community against COVID-19. And in fact, I had communicated in the past, trying to remember the details. I'm sure that I've communicated in the past going into this, that this blitz would be coming. So overall, I feel confident that my staff are striving to be fair, but to apply the law.
Understandable. And also, I spoke with another business who is, very eager to recover financially, but also very worried that they're coming out of the second wave and then going back into a third. Do you think that there are measures in place to prevent a third wave?
I think that we're in a precarious situation, and I've indicated before that I'm concerned that ceasing the stay-at-home order and the shutdown would leave us vulnerable to having more cases happening, especially with the UK variant in our community. There's the potential for us to end up with a surge of cases that would require then that kind of stringent lockdown again.
Thank you. I really appreciate your time.
You're welcome.
Okay, James Bowler from Cogeco, please.
Thank you. Dr. Gardner, a question again about splitting Simcoe and Muskoka. We have a number of politicians, including Mayor Smith, petitioning on behalf of this area to split this up and saying that he's hopeful that will happen. How much does that weigh on the decisions that you're making? And can you actually give some clarification on who makes the final decision here? Because there seems to be a bit of kicking the can back and forth sometimes with this. So if you could kind of clarify who exactly decides that the region should be split, that would be helpful as well. So
the province makes this decision. The cabinet makes this decision about exactly what's done. The Chief Medical Officer of Health advises cabinet and the Premier. The Chief Medical Officer of Health seeks advice from Public Health Measures Table and from local MOHs. But in the end, the decision about the overall approach and about some of the details of it rests at that level of government.
And just the question I asked you, how much of this political request, does that weigh on these decisions? With Mayor saying, these businesses are struggling, basically almost, for no real reason because we're not in the same boat as Barrie or Simcoe or anything like that. Well, how much does that weigh on those decisions?
It is something that I've made the province aware of on a number of occasions. I always point out that there is a difference. I've pointed out earlier today that if you were to make that split, probably you'd get more transmission happening in Muskoka as people would migrate there to take advantage of them being more open. And so your difference would start to shrink. It wouldn't be as great as it is now. So that's I think, an important consideration. But overall, the approach the province has taken so far is to deal with health units as a whole rather than breaking them into smaller units to apply its framework. And I believe that they continue to be committed to that approach.
Thanks for that. Just a quick follow-up. In terms of the color that we're supposed to be in when we kind of stay-at-home order, the province announced yesterday that this order will be lifted next Tuesday for Simcoe, Muskoka, but we still don't know where we're going to sit. I'm just curious as to why that decision isn't in place yet. The province is prepared to say we're ready to lift this order. Why would we not know which part of the framework we fall under? Because there's a lot of business owners that, they want to know where they're going to be next week.
Yeah.
And also, what is playing, who again, to my earlier question, who plays the final role in deciding that?
So the province plays the final role. They may seek my advice, but they make this decision. I don't know when or why. I don't know why it hasn't been decided or when it will be decided. Clearly, it would have to be decided before Tuesday. It would be advantageous to us as a health unit to know as well, because we need to be prepared for our enforcement and education role. But at this point, we don't know that information either. We don't know the decision to come.
Thank you very much for your time.
You're welcome.
All right, Mark Claremont from Muskoka, please go ahead.
Hi, Doctor. Thanks very much. Going back to the stay-at-home discussion you've spoken to a couple of times today, and I'm just curious, from what you've said today, how do you square your position of you'd like to have seen the stay-at-home orders continue, yet you spoke early at the very beginning that you've been an advocate for the schools to reopen, particularly in a follow-up to that, and you mentioned just near the end here that it's quite possible that March could be a troublesome time for the VOC. The fact that there's the March break coming up, I just wonder how that all sort of works together, how you can put the two and two together.
Well, we've had to make competing decisions, competing priorities all the way along through this. And all the way along, public health has been an advocate, certainly in the second wave, with children having in-class education for their own well-being, their health, their mental health, for their education. This is in part based on what we've seen of negative impacts on their well-being in the first wave. And in part based on the fact that we now know that it's not as transmissible in children and not nearly as negatively impacting in children. And also our experience was that during the Christmas break, disease rates in children actually went up considerably. That the home environment isn't necessarily a safe environment, or out in the community is not necessarily a safe environment for them from a COVID point of view, as opposed to being in a very controlled environment in school. So I would continue with that position. And I would say that staying at home while you otherwise do essential things is consistent. So there are essential reasons to leave your home, and one of them would be going to school. Going to essential work would be another, being physically active would be another, seeking medical attention or doing essential shopping would be another. So it would fall into that category of essential reasons to leave home. And I think we're more likely to be able to keep our schools open if we're otherwise staying at home, because if we can otherwise go out more freely, there'll be more transmission. The more transmission that's happening in the community, the more likely we are to see some children get it that way and take it to the school and disrupt school with classes having to be isolated because of an exposure, and the potential for schools to have to be closed because of that kind of dynamic.
Okay, so just quickly, you don't advocate the March break taking place, and just as if I just add an extra quick question while I'm here, I understand that people with dementia are twice as susceptible of obtaining COVID. Have you seen that? Is that the case that you've seen?
So about March break, I would say that's a decision the province has to make right now. I could see advantages to it being postponed. Children will have just gotten back into class. They'd be just getting the benefits, the mental health benefits of being together. It'd be nice if they could continue that with, longer into the year. But that's a provincial decision to be made. We do know that dementia puts COVID cases at risk, both in terms of potential for transmission, because in an outbreak they wander and therefore are more likely to encounter it in the facility, or if they have it are more likely to transmit it. So that becomes a risk factor, and being elderly puts you at much greater risk of mortality, and dementia comes with, generally speaking, it comes with age.
Great, thanks a lot.
You're welcome.
Okay, thank you. Do we have anyone from Simcoe.com on the line today?
Oh, yeah, Chris Simon's here.
Okay, go ahead, Chris Simon.
Thank you very much. Dr. Gardner, I was speaking with the Ministry of Labor about the inspection blitz over the weekend, and they said that they had about 50% compliance from businesses. Do we see this as an issue, a major source for transmission that maybe should require more enforcement?
I look forward to seeing the data. Sorry, I'm getting an echo. Somebody's going to have to mute, I'm afraid. I look forward to seeing the broader data from my staff about all the, how the enforcement went with the other agencies. So that figure is an important one to me. I didn't know that. I look forward to therefore getting an understanding of just what the compliance issues are beyond what we saw. But these measures are in place to protect people and to reduce transmission. And indeed, we've seen plenty of transmission in work environments in the first and the second wave. Therefore, non-compliance is an issue. It would be at least part of the explanation for why we see the transmission that we do.
And then a follow-up question, if I may. What do you think that long-term care facilities can learn from the situation at Roberta Place now that we've kind of rounded a corner on the situation?
I think we all need to take the UK variant very seriously. We do not have additional recommendations for them about infection prevention and control measures, but it really speaks to the importance of them being adhered to the utmost. The facilities have had assessments in the summer by RVH, by other locales, and they need to have a look at the details of that to see what it is that could be improved. They need to reach out to partners, us as a health unit as a resource. It's a good thing we've managed to get immunization in those facilities, so we want to complete that, and hopefully that'll go a long way to reducing risk. We still have many care providers and staff who have not yet been immunized, and so when we get more vaccine, we would really put it out to them to do all they can to maximize immunization. As a health unit, we're looking at the potential to tighten up requirements as well. In particular, the requirements for screening. So right now, the long-term care facilities are working with the province to put in place a rapid testing protocol for anyone coming into their premises, that they be tested, they get the result before they can come in. That's a very good thing to get into place. I think they really need to embrace that, but I think it would be important to look at policy about sick individuals in the household, not just the staff that are coming in, but any of their household members who are ill, that in fact you'd need to get to the bottom of what's happening with those situations before people would enter the work environment.
Thank you very much.
You're welcome.
Okay, thank you, Chris. Has anyone not had a chance to ask Dr. Gardner a question today?
Yes, sure. Mary today.
I'm sorry, we had two at the same time. Could I get the female voice first?
Marge would have been Barrie today.
Okay, go ahead, Marge, please.
Okay, I have the crappy questions of the day. I'm interested in your take on the significance of the wastewater testing and the early results that you've seen of it for Barrie and or any other communities in Muskoka.
Thank you for the question. Ottawa Public Health has used wastewater testing as a means of surveillance for the community as a whole. And what they found was that it correlates well with outbreaks, with case counts, that it comes a little bit earlier, it changes a bit earlier. So I would love to have that tool for a number of my communities. And now University of Ottawa has come up with a way of detecting the UK variant through wastewater. Clearly, I would like that because it would help answer the question, is it circulating freely in the community? Is it going up? Is it going down? Are we getting control of it or not? We don't have, apart from their preliminary trial in which they did a proof of concept by testing wastewater in Barrie and demonstrating that they could indeed detect the UK variant, which is not a surprise to us given the outbreak at Roberta Place. We don't have a regular arrangement to get the results, so we don't know how often we'll get them. We need that kind of thing nailed down so that we know what we're dealing with in terms of the surveillance tool, and I would like to get this in place in our other municipalities as well.
Okay, so I have something to question, but if you can clarify, you're talking about the new Ottawa testing lab, you're not talking about the Ontario testing lab, right?
University of Ottawa and CHEO, the Children's Hospital of Eastern Ontario partnership that they have.
Okay, because there is the other testing going on at Ontario Tech University.
Yeah, and that I don't have good information on, I'm afraid.
Okay. Now, can you just quickly touch on the role and future of wastewater testing, especially locally in public health epidemiology? Seems like this is something that has great potential and has had some priorities.
Yeah, it'd be another means of doing surveillance in the community. Like for example, I get the question, and I ask myself the question, what's happening with the UK variant? How can we know if it's increasing or decreasing? We'll have a limited ability to know by testing people alone. We're following up on contacts of the cases that we know, but if it started to spread beyond that to others that we don't know, how would we ever detect that? We could be quite delayed in detecting it. We'd have to wait until they become cases and they come forward to be identified as cases. There could be some delay with that. We'd have a higher degree of confidence in what we know if we also had results of wastewater testing that would show that it's going up or that it's going down.